A remarkable new technology from GE Healthcare is bringing the benefits of deep learning to MRI. Recon DL fundamentally shifts the balance between image quality and scan time. This has the potential to completely change the way we think about MRI. This is unmissable.
It is really remarkable what Recon and the deep learning algorithm can do. In fact, our eyes are so used to misinterpreting noise as detail in the image that when you first see these images, you're like, oh, there's a difference. And it takes a little while to get used to.
We've done a lot of experiments comparing traditional pulse sequences to the DL Recon. We are not losing anatomic detail with the appropriate parameters. We're able to see fine trabecular detail. We're able to see everything we saw before, but with better image quality.
Before I actually used Recon DL, I didn't have very good understanding about AI. So I thought it should be a little bit more complicated or something difficult, but actually Recon DL was so easy to use.
Before we performed our trial, I was concerned about deep learning technology bringing artificialized, plastified image quality or having to add too many post-processing time to reconstruct the image. So that's why it was very important for us to perform the trial, to see with our own eyes that the reconstruction didn't add any time to the acquisition, and the image quality, I know there's different levels for a Recon DL, but even when we pushed to the maximum level, we didn't feel that the image was artificialized, was plastified.
The healthcare professionals with AI, their roles will become much more simplified and automated, giving them time to focus on spending time with you as the patient and doing what they do best, which is the clinical insight.
The diagnostic confidence of the Recon DL means that we analyze all the raw data in a very short period of time. So that means that we are going to obtain the best quality of the image. The best quality of the image means that we are going to see much more than we see normally.
There were many times where in the evening, on the weekends, when our app specialist wasn't there or I'm not there, where a technologist would contact me and said, hey, this protocol doesn't have DL on it, can I use it? And then how do I use it? And my answer was very simply this, turn it on. And they said, what? And I said, you see the button that says DL? Yeah, turn it on. Put it on high. Enjoy the SNR.
With Recon DL, we can get smaller field of views, for example, for small parts like the toes or fingers, but we can also reduce the slice thickness for important things like T2 imaging of rectal cancer and prostate to standard 2 millimeter thick slices with really high resolution.
The most impressive part of Recon DL is that Recon DL can reduce the truncation artifact. We are seeing many truncation artifacts in pediatric brain imaging. I've never seen any other techniques that can reduce truncation artifacts.
With the Recon DL, we can increase the resolution of the images. So with that high quality images, the confidence level of diagnosis has become much better than before.
We've trained it in a way that allows an AI algorithm, like a deep learning algorithm, to learn how to go from a typical, corrupt, noisy MR image into something that is essentially perfect.
We continue to invest more and more in deep learning. And the other area of big focus for us is the user interface and the interaction between the technician, the operator, and the machine, and how we ease the process of setting up the patient, setting up the scan, making sure the scan is done right first time, making adjustments during the course of the scan, having a more dynamic interpretive scan. This, I think, is really a big area where AI will come to play. I'm very enthusiastic about how AI will keep driving healthcare forward.